So hello, I'm Jeremy Fauconnier, nucleus member of the Scientists of Tomorrow from the European Society of Cardiology, and it's a great honor for me today to make the interview of Professor Barbara Casadei. So Barbara Casadei, hello. You are a medical doctor qualified at the University of Pavia in Italy, and you obtained in 1995 your PhD in cardiovascular medicine at the University of Oxford. You are now Professor of Cardiovascular Medicine at the University of Oxford and the new President-elect of the European Society of Cardiology. Your main research topics focus on translational research on nitric oxide and redox signaling, especially in the context of atrial fibrillation. So one of our first questions that we have among the scientists of tomorrow is that you are an MD, PhD, and you are recognized both as an excellent clinician and basic scientist. So how do you balance clinical commitments and research?
The reality is one doesn't. One is trying to do both, and there are advantages in that, because if you continue to do research in parallel with your clinical work, you focus it in a way that is relevant to the clinic, so you stay real as far as your aims are concerned. On one hand, you maintain a certain inquisitive mind, which is useful. You learn how to assess evidence. So these are all the pros. The cons are that it's very difficult to be as good as those who are just doing one of the two. And so you're always struggling to catch up and be a good clinician on one hand and find the time and be a good scientist on the other. So it's a difficult balance. It's possible, but it's difficult, challenging, I would say.
Okay, so in addition of your clinical and basic science activity, you also contribute for many years to the ESC activity, first as the chair of Cardiac Cellular Electrophysiology Working Group, then as the chair of the Council for Basic Cardiovascular Science, and now as the president-elect of the European Society. And most of your initiatives were toward the young community. So could you explain to us how the European Society can support the career of young clinicians and scientists?
Oh, in very many ways. Through we have invested a lot in education, in training. We intend to increase the number of fellowship and traveling fellowship to establish networks of research within Europe and even beyond. But the main focus is Europe for the moment, and through accreditation, we are trying to establish many of small targeted as well as large science meeting to help the young people to present the research, to network, and to find their next job. I am particularly keen that there should be work mobility within Europe as far as science is concerned. I think everybody will benefit from that, and within the financial constraints that we have, that is certainly an area where I would like to invest.
And during the last 2 years, you were very involved in the gender equality, I would say, and you, as the vice president of the scientific affairs of the ESC, you engaged during this period the women in the ESC initiative. So could you highlight the achievement of these ESC initiatives?
Yes, this was really an initiative that aimed to provide female cardiologists with tools to establish their leadership skills. So there are, and it is a pragmatic choice because there is a high number of female trainees in cardiology and a very low number of women in leadership position. There isn't much of a history of role models for these females, and although females represent 1/3 of the membership of the European Society of Cardiology, very few are actually engaged in the main committees of the European Society of Cardiology. So the leadership course was a very well received initiative that will provide an increasing number of women with these tools to establish their own leadership. We have then also established a collaboration with Brandeis University in the United States to actually probe, and this is both for men and women, what is the culture of the working place. And through this type of investigations, I think we will be able to have a much clearer picture of how people feel they fit in their work environment and what it is that we might, as society, be able to do to improve the status quo.
So, as now a president-elect of the ESC, what do you hope to achieve during your presidency?
That would be very much dependent also on what the resources will be available. I like to focus on what only the European Society of Cardiology can do. So not to duplicate initiatives, but really, really bank on the strength of the society by focusing mostly on development of research activity across Europe, influencing the research environment at the European level and also at the level of the individual heart associations and funding agency in every country. I like to establish networks of research, and I like to work on advocacy, because I think that is where the heft of the society would have the greatest impact. I'm also very interested on some introspective, if you like, analysis of what it is to be a scientist and a cardiologist in the next 10 years. How would our profession evolve, and how we should learn to directly communicate with the citizens and with the lay press. So there are many pressing issues, and these are some, as well as the evolving relationship of research and clinicians and the pharmaceutical industry. And these are all very important issues that I would like to focus on.
Okay, so Professor Casadei, thank you very much on behalf of the Scientists of Tomorrow. I was very pleased to make this interview. Thank you for your support, and I'm sure that we will continue to increase our involvement in the networking and help the European young community. So thank you very much.
Thank you.